Today we got to speak with Matt Frederickson. He's wrapping up his PGY 2 year at the UC Davis Department of Orthopedic Surgery. He talks about everything from his journey to how to excel as a medical student and also just how to push through difficult times. Uh, and with that, we'll get right into it. Running through from undergrad, taking you to where you're at now. Did you do gap years, etc.? And then where along there did you first find that you were interested in orthopedic surgery?
I went to UCLA and did not do super great there in my classes. I got recruited to play rugby there and just had a lot of bad injuries. And that, like, not doing well at UCLA, I knew I wasn't gonna, I thought I wanted to go to med school, but I knew I wouldn't get in because my grades weren't great early on and I had to kind of dig myself out of a hole. Um, so. I took like once I graduated, I took multiple gap years. I think it was like five total. But I always kind of thought that I wanted to go to med school. But the kind of a cliche why ortho answer, but those injuries it also made it harder to, like while I was struggling in undergrad, also kind of was probably my initial introduction to orthopedic surgery because I've had four orthopedic surgeries myself from rugby. So was kind of a blessing and a curse, I guess. But yeah, I did 5 years in between undergrad at UCLA and med school, where I was just working and still playing rugby at that time, like uh, just men's rugby. And I worked as like a medical assistant, and that working with patients was when I knew, like, okay, I definitely want to go to med school because that was like it felt right and I was excited about it, just like clinical stuff. I went to Cincinnati for med school. It's the only place I got in, and unlike Hannah, I kind of knew ortho all the way. By the time I had started med school, the year before med school, I worked in an orthopedic clinic. I worked in a sports medicine clinic in San Francisco for the team doc for the San Francisco Giants, and that was very, very cool. And with that experience, I was like, yeah, I want to do ortho. So I started medical school with ortho in mind. And then basically, the closer I got, the more and more I was like more interested and more sure about it. When I was a third year med student, I kind of took the mindset rotating through everything. Like, I'm going to imagine myself doing this and see if I like it. And I liked, couple different things, but I always was pretty sure about ortho. When I rotated on to ortho as a third year, I was like, yeah, this is really cool. But it wasn't till my fourth year when I was doing sub-Is and like, ortho rotations back to back to back when I like really kind of, I don't know, enjoying like liking it went to loving it because I think the more time you spend with it, the more it makes sense. And like early on, it can be you first time in an orthopedic OR, you're like not 100% sure what's going on. And even now as a resident, like the more time you spend, I would say certain surgeries are more enjoyable as a two than as an intern. Um, so just kind of gradually became more and more interested in it. And then, yeah, I'm from Northern California. So I rotated at basically all West Coast programs as a fourth year. And rotated at Davis, really liked it, and super happy to have matched here because my dad lives in Davis and my mom lives in the Bay Area, so I'm pretty close to family. But yeah, that's kind of my path
Yeah,
to
that's
ortho, and I
nice.
would say rugby introduced me to it. The first orthopedic surgeon that I met was evaluating me for an ACL tear, and he's like, "What are you doing with your life?" And I was like, "Oh, I'm thinking about med school," and he was like, "You got to do orthopedics." So that was kind of my first introduction, I guess.
What are some things that like you really love about orthopedic surgery? The things that you're most excited about? You kind of touched on some of these things, but it'd be cool to hear if you could like expand on that.
Sorry, I was just struggling to unmute myself.
Oh, you're good.
I think something that a lot of like people in orthopedic surgery would cite is like like the immediate results of our field. You get to like take a problem and fix it right away. Hannah may have mentioned this too, but like if someone comes to the emergency department with like a femur fracture or a tibia fracture, like they are having one of the worst days of their life, and you get to like, you know, talk to them, get them, ready for the OR, get them all the stuff they need, and then you get to tell them like, hey, we're gonna fix this, we're gonna take care of this. We treat this all the time, and the cool thing about the surgery we're gonna do is you're gonna be able to walk the very same day of surgery, and like taking someone that otherwise could not walk and giving them the ability to walk back immediately. And obviously they're going to be a little sore and slow to start, but like that I think is really cool, the immediate results. Uh, the outcomes for the patients in our field are really, really good. So, you're giving people physical function back, and in a lot, especially in the elective, like subspecialties or procedures within orthopedic surgery, the outcomes are great. So that I think is just a positive thing. I really love musculoskeletal anatomy. I think as an athlete, not a very good one, but as an athlete, I sort of learned a lot about anatomy through like training and my own injuries, and um, kind of back to the path question, the last question, but like in anatomy lab was like the first time in med school I was like really enthused, and I was like, this is awesome, and kind of lost myself in it. And if you like anatomy, I think orthopedics is an amazing specialty. But yeah, musculoskeletal anatomy in particular, I just really like. Um, it's also, I think, very cool to be like an expert as a consultant, like a subspecialty orthopedic surgery. Like people are going to be, consulting you because you have an expert skill set and knowledge. And I think that's really cool to be like the most knowledgeable person about, you know, musculoskeletal problems in the hospital. If you like the OR, I think at least at UC Davis, like our department probably operates more than any other subspecialty. Just because so many people have orthopedic problems. So we always have patients that need surgery. Um, as opposed to like some other surgical subspecialties. Like I think trauma surgery within gen surg is probably like excuse my language, but like most badass of all surgeons, but they don't operate quite as much as we do just because it's not as frequent that they're going to the OR unless someone's like really crashing. And I think that's cool, but a lot of what they do is more like they do medical management as well, and we're just like always in the OR. So if you like operating, that's, just another great thing about orthopedic surgery. But I kind of think just like all those things combined, I don't know, it just felt like it fit me well. And I've like the interesting thing is the more I also kind of said this already, but the more I do it, the more I love it. So it's just I feel like very lucky and blessed to have found this specialty.
We're all med students. We're going to be entering the OR maybe for the first time as a medical student. We're going to be doing rotations. We're going to be doing sub-Is. What are some general advice you guys have for us entering this maybe unfamiliar environment, integrating into that, and succeeding as we move on to the clinical side of things?
I mean, it's probably like obvious, or you may hear this over and over again when, approaching your third year or first time in the OR. But I would say just understanding there's a certain etiquette to the OR, and certain, just like unspoken rules. And I think getting a sense of what those are ahead of time, it will set you up for success. And then there's just certain like keys or tips that will just make your life a lot easier that again are pretty common sense, I would say, but just like reminding you ahead of time is will help you. I think the number one being again obvious, but just being like very friendly to all the staff. In particular, the people in the OR, the scrub tech and the circulating nurse, because they kind of make sure everything's running. Like a lot of people, I think, when they're on their surgery rotation, will focus on like, oh, I need to do a good job to impress the surgeon. But like if you focus only on them, you will miss the mark by a lot. And I think what's great is when you like befriend the scrub tech or the circulator, and then they make you look good, and they make sure you're not like left out to dry or in an uncomfortable situation. So focusing on, you know, being friends with everyone and being polite and respectful to everyone is super key. Your first time in an OR it will be intimidating, but if you just like go up to that person and introduce yourself with a smile on your face, and like that'll start things off right. And then I don't know. I think some people would call this maybe like toxic. I'm not sure it's toxic, but in the OR, like people aren't always going to be addressing you and including you and talking to you. And that's unfortunately that's just kind of normal for the OR. And that's because, you know, the focus of the OR is the patient and that surgery for that patient. So being kind of comfortable with silence and like I don't know, the toxic way to say it would be like speak when spoken to, but like just knowing that like there's a good time to talk and there's a good time not to talk, I think is like if you can be emotionally intelligent about that, then that will like protect you from, I don't know, getting on a surgeon's nerves or something like that. And I think just keeping those things in mind, and they may seem like common sense, but like they're very important. The first time in the OR, I think you'll be a little uncomfortable and you're gonna feel awkward because it's like an environment you're not used to. And I think just try, like you're gonna have this like gown on and your mask and everything, and you're gonna be like hot and sweaty. If you're in a orthopedic OR, you might be wearing lead, and so like you're just like you're not gonna feel super comfortable. But just like trying to take a deep breath and relax and just kind of get into like just focus on the surgery and almost like a flow state if you can. And it's hard to do that when you're not the one doing the procedure, but you can do that. And I think if you can allow your body to relax and just kind of, you know, get into a place where you're like trying to become a little bit more comfortable physically, that can help a lot and help you enjoy it. If you're not enjoying every moment of it, I don't think that's bad. I don't think you should be like, oh no, surgery is like not for me because I don't love being sweaty in a gown wearing lead for 4 hours. Like that, everyone, that's hard for residents too. So like, keeping that in mind. And it's like, it's not the OR is not an easy place, so it's okay. And then I would say tips for, specific to the orthopedic OR that could help. Two small tips, but like I think very important. One is just trying to be a little bit prepared for the case, with especially with regard to anatomy. So when you're a med student in the OR, the big things they're going to expect you to know is anatomy, and the anatomy is based on the surgical approach. So, um, you can look that up pretty quick before a case and just kind of go over, okay, like what are the landmarks for us marking out our incision? Like, how do we know our incision's in the right spot? What muscles are we going to encounter? What nerves and vessels do we need to look out for? And so if you can look that stuff up before the case, usually that's what they'll ask you about. They're not going to ask you like, what are the indications for this versus that, and what is the difference in outcomes between like, this and that. Like that's more complex. So really you're going to get asked about anatomy. So just taking the time to go over your anatomy, and then during the surgery, you want to be, engaged as you can be and show that you're enthusiastic, but the time to show that is not in the most critical portion of the case because they're not going to want to be having a big conversation when they're trying to get a hard reduction. So a good time to ask questions is once we start closing. So once we're suturing, like that's when okay, now's my time to like I can start talking and ask all these questions I had about what just happened. And I think if you remember that, then you can like your timing can be really good as far as like the thing I said earlier about like knowing when to talk. Closing is always a good time. When they're doing the approach, they'll be asking you questions, and when you're closing, you're asking them questions. That's kind of, I think, what you can expect.
I also was wondering, kind of building off that, how do you guys, maybe as residents, really learn from cases? Because I know sometimes I can walk into the OR and just watch, and it's just like you're not thinking about things or you're not learning something from every case. Do you have any methods that you do to take something out away from the case? Do you write on a notepad? I saw some some students doing that? Um, or do you just look up things after, ask questions? Anything you could speak on in regards to that?
The more preparation you do ahead of the case, the better things will stick. Because like you'll look up I don't know, like an ACL reconstruction and you'll be like, okay, these are the steps. And then you'll get into OR and the surgeon will do like one or two steps differently and it'll stand out to you because you prep for the case and then you'll like that will be whereas if you hadn't have prepped that well, you just wouldn't know that that was done differently or something like that. And then that kind of helps things like stand out more or become solidified. And then kind of back to like what we were saying about like what the OR is like for the first time. Like a lot of it is you're just kind of in your own head, like you're paying attention, you're focused, maybe you're holding a retractor or something, but there's not a lot of like you're not doing a lot of conversation. So you're just like kind of in your own head trying to focus. And I think the best thing you can do in that kind of scenario is like try to think what is going to come next, like to anticipate the steps of the surgery on like a gross scale, it would be like, okay, after we do this stage in the procedure, what's the next stage? But on a more micro scale, I think where you can really get a lot, especially in that orthopedic trauma OR, is the fluoro. And so if like someone's moving their hand to try to adjust their trajectory, like looking at the floor and thinking like, okay, if I was them, how would I move my hand to make that wire go the way I want, like the way I want it to go? Like, do you even know the way we want the wire to go? Stuff like that. And I think for me, the biggest difference between my third year as a med student and my fourth year as a med student was as a fourth year, I felt like I understood what was going on in the fluoro the majority of the time. When I was a third year, I was often very confused by the fluoro. I'd be like, okay, I know what bone that is, but like I'm not sure what's going on or like what we're doing here. And so once the fluoro starts making sense, then you like your 3D thinking is making more sense. And I think that's a good way to kind of stay engaged in the case and take more from it. I do not currently have a good way of like learning stuff after a case. I think that's really challenging, especially when you have limited moments to like go maybe eat something or like go to the bathroom and then you gotta get ready for the next case. So like that's very challenging still. But I think the more you know, the easier it is to take things from cases because instead of like going into a case and you don't know anything, it's like you know the majority, and then you're like learning one thing that stands out. So I think that just comes with time too. But uh but yeah, I think the biggest thing would just be like that, like anticipating the next step. Because then if so, something it'll things will stand out if they're like if what happened what you expected to happen or it's not, and then you can think about why you're thinking, stuff like that.
I do have one more question, but I do want to see if anyone else has a question you guys can ask now as well. But if not, I can ask the last one and then we can wrap things up.
I had a quick question. Just out of curiosity, since a lot of orthopedic surgeons do come from like a sports or pretty active background, um, as residents right now, do you have time to do your like outside hobbies in addition to working? And I know it's different between like residency versus life after residency, but I was just kind of curious in terms of like work-life balance in residency for orthopedics.
I play Australian rules football now. I used to play rugby, but it's too rough. So I play Aussie rules and I have managed to play a decent amount in residency. I got to go play in another country for the USA like reserve team in Canada. So and I did that during trauma, which is was hard and I got it's rare to get time off during trauma, but which is probably the hardest, but I got lucky that that worked out. So you can definitely do maintain some hobbies during residency, like Hannah said, it's definitely variable by rotation. So there are rotations where you're going to be working super hard and you're not going to be able to do that stuff as much, but there are rotations that are easier and you'll definitely have time. I think it's hard to have the amount of hobbies and you don't have the same amount of free time as like your friends who aren't in medicine, but you guys being med students like already kind of know what that's like. I think if you have one or two like hobbies that you care about a lot, you can definitely prioritize those and make them happen. But you're not going to have like the normal hours, like a 40-hour work week, be able to do all the things you want to do. But like if something matters to you a lot, you can, make it a part of your life. And for me, that's something fitness related. It's Aussie rule football, but I think a lot of residents come from athletic backgrounds, but like definitely not all. And so like if you're not, an athlete, that doesn't mean you're not a fit for ortho. Like the diversity in ortho is, I think super important. And that's something that I actually really like about our program is like we have like I would say a very diverse residency, like diversity, like number of women in our program, number of different, I don't know, ethnicities, backgrounds, hobbies, everything. So I really like that. But yeah, to answer your question, you can definitely like I play Aussie rules football and I'm a resident and this PGY2 is the hardest year. So it can be done.
Great question. Anyone else have any questions for either Matt or Hannah? Both thoughts, concerns?
Yeah, I have a quick question. So, my question is, what were your expectations or preconceptions you had during med school of what it would be like to work in orthopedic surgery, and how did that compare to actually working as a resident? And then, like, do you have any advice to kind of manage those expectations for us students right now?
I think not really just residency in general. I think for me, what I didn't realize is like just like you work a lot as a resident no matter what field you go into, some more than others, but orthopedic surgery tends to be on the harder working side of that spectrum. And I think just like not knowing what that would be like, the hours and like the kind of fatigue, you're just like you're working your butt off. And like I think med school is a introduction to that for a lot of people. Like I used to say med school feels like you're in finals week every single week, like undergrad finals every week. And so that was like a big step up. Residency, you're not studying as much, but the hours you're at the hospital is way more. And like, that as a med student, that's coming, but I just like living that and like what that feels like. I just didn't really know what that was like. And it's like, it's doable. It's just like, you know, I'm you're tired a lot as a resident, but again, it's doable. I remember being a med student like on call rotating with an orthopedic surgery resident too, and they were like really stressed out and being kind of like blunt and mean over the phone to the ED consulting them, and they're just like, I don't, they seem like high strung, and I was like, oh man, when I'm a resident, like I'm gonna be nice to everybody, and like I became if you live long enough, you become I don't know. I'm like, now I'm like that. I'm like, I try to be nice, but sometimes I get stressed. And I think the nature of the job, it's just like, can be, and again, I think this probably goes for any specialty, not just orthopedic surgery, but it can just be very chaotic. And you're like, your responsibilities are, big and it's stressful. And, I don't know. Was med school stressful? Yes, but like it's a different kind of stress residency is. And I think that stress just kind of like morphs you a bit. I don't think I'm permanently changed, but like when you're on call, you just like I feel like I'm a different person and like I didn't know what that would be like. And I don't know. I think it's normal. I think that happens to a lot of people and it's just like it's just part of it. And it's like anything you do for the first time, you're not really sure what it's going to be like, but like what I would tell myself is like look like there's so many people who have done this before me. Like, why can't I do it? And so I think you guys hopefully have that same mentality. It's like, residency's hard. The hours are hard, it's stressful, blah, 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 but like so many people have done it. It's like you can do it too, right?